Hi, I'm Elliot Tapper from the Liver Center at Beth Israel Deaconess Medical Center in Boston. The title of my paper in CGH is Psychoactive Medications Increase the Risk of Falls and Fall-Related Injuries in Hospitalized Patients with Cirrhosis. Now, we undertook this study for a few reasons. First, we are deeply interested in improving the safety of our hospitalized patients with cirrhosis. And falls are an important and understudied form of preventable harm. Second, inpatient falls are coming under increasing scrutiny by payers and are now tied to hospital reimbursement by Medicare. And third, it has been previously shown that long-term use of psychoactive medications is associated with falls for outpatients. So we hypothesized that inpatient provision of psychoactive medications may be linked to falls, and if proven, this would suggest that there is an opportunity to prevent a particularly important harm for our patients. We reviewed 1,749 admissions for patients with cirrhosis to our liver unit over roughly 3 years, 3% or 55 of which resulted in a fall, 21 with injury. And we found that antipsychotics and benzodiazepines were strongly associated with the risk of a fall. Now, when crafting this association, we were concerned about confounding by indication. We know that medicines such as benzodiazepines or antipsychotics are often provided as a way to subdue or calm patients. And so there's a risk that these medicines were being given to patients who were sicker or more encephalopathic. So in order to address this, we created propensity scores for 90-day mortality and active hepatic encephalopathy. However, even after adjusting for these factors, the risk of falls associated with benzodiazepines and antipsychotics were 6- and 3-fold increases, respectively. We also found that the risk of falls between cirrhotic patients on our service and general medicine patients admitted elsewhere was roughly equal. However, the risk of falls with an injury were 3 times greater amongst patients with cirrhosis. In conclusion, psychoactive medications increase the risk of falls and fall-related injuries for hospitalized patients with cirrhosis. In response, we have begun a program of quality improvement that we term Psychoactive Medication Stewardship. And what this looks like in our hospital is electronic prompts to warn providers about the risks of antipsychotics and benzodiazepines, and a program of daily review of medications on rounds to ensure that patients do not get exposed to medicines that put them at increased risk. Thanks for your attention.